Hello, hope you guys are doing good. Welcome back to our YouTube channel. So today we have with another video, medical billing and coding. So let's start the video. This is the link naming MB and CC. What is medical billing and coding? Medical billing and coding are two closely related aspects of the modern health care industry. Both are practices involved in the immensely important reimbursement cycle, which ensures that healthcare providers are paid for the services they perform. For the sake of simplicity, let's divide the two at the moment and look at them as separate pieces of a large process. What is medical billing and coding? Study tools. Review and keep track of what you have learned by downloading the slides for this lesson. So, if you want to study their tools, you have to download this slide. Download our free text, find the program for you, medical coding. Medical coding at its most basic is a little like translation. It is the coder's job to take something that's written one way, a doctor's diagnosis, for example, or a prescription for a certain medication, and translate it as accurately as possible into a numeric or alphanumeric code. For every injury diagnosis and medical procedure, there is a corresponding code. There are thousands and thousands of codes for medical procedure, outpatient procedures, and diagnosis. Let's start with a quick example of medical coding in action. Features online medical coding programs, medical billing. On one level, medical billing is as simple as it sounds. Medical billers take the information from the medical coder and make a bill for the insurance company called a claim. Of course, as with everything related to the healthcare system, this process is not as simple as it seems. To get a better look at the medical billing, let's rewind the example we used earlier. Our some patient has a cough, fever, and it's producing lots of mucus. This patient calls the doctor and schedules an appointment. It's here that the medical billing process begins. The medical biller takes the codes, which shows what kind of visit this is. The medical biller therefore acts as a sort of waypoints between patients, healthcare providers, and insurance companies. You can think of the biller like the coder as a sort of translator, where the coder translates medical procedures into code. The biller translates codes into the financial report. The biller has a number of other responsibilities, but for now, you should simply know that the biller is in charge of making sure the healthcare provider is properly reimbursed for their services. Okay, jump to a different section. What is medical billing and coding? What is medical coding? What is medical billing? NBAC at work, certificate prep advice. So this is a different things, you can check them. For example, we have to learn what is medical coding. So learn more about medical coding. Their study tools, download our free textbook, find a free textbook, find our program for you, learn more about medical coding. Why we code? Let's start with a simple question about medical coding. Why do we code medical reports? Wouldn't it be enough to list the symptoms, diagnosis, and procedures, send them to an insurance company, and wait to hear which services will be reimbursed? To answer that, we have to look at the massive amount of data that every patient visit entails. If you go into the doctor with a sore throat and present the doctor with symptoms like a fever, sore throat, and enlarged lymph nodes, these will be recorded along with the procedures the doctor performs and the medicine the doctor prescribes. In a straightforward case like this, the doctor will only officially report this diagnosis, but this still means the portion of that report that will be coded contains a diagnosis, a procedure, and a prescription. So here is a more detail about this. Three types of code you'll have to know. ICD. The first of three is the International Classification of Disease or ICD codes. So this is the information about ICD code. Another is CPT. Current Procedure Terminology or CPT codes are used to document the majority of the medical procedure performed in a physician's office. This code is published and maintained by the American Medical Association AMA. So here is the third HCPCS, Healthcare Common Procedure Coding Symptoms, commonly pronounced as the HCPCS, are a set of codes based on the CPT codes. So here is the all three types of the medical coding. I hope you like the video. Like, do comment, share, and subscribe. Thank you.